We're back talking about how the chemistry and makeup of our brain actually changes from trauma. We're talking to psychiatrist and brain health expert, Dr. Daniel Amen. Tell us now what happens to the brain when we experience trauma.
I actually published a study on 21,000 people looking at emotional trauma versus physical trauma. Emotional trauma activates the limbic or emotional brain, and we become more worried, we become more anxious, we become more sad. So if you've been traumatized, and there's been so much of that in the last couple of years, it heightens your limbic brain. So you're sort of always watching for bad things to happen. The good news is we can calm it down, but emotional trauma causes physical changes in the brain.
Gotcha. And Doc, I understand you also have brain scans of somebody suffering with PTSD and comparing that with a healthy brain. So walk us through that. What exactly are you looking at?
In a healthy scan, if we just look at the blue, red, and white ones, the bottom part is active, and everything else is sort of quiet. In this post-traumatic stress disorder patient, you see what almost looks like a diamond of increased white activity. That's their emotional brain that's literally inflamed. It's working way too hard. So even though the trauma may have happened months or even years ago, it's still living in their brain every moment of every day. It has literally changed their brain to become hyper aroused. And that's why they're always looking for something bad to happen.
And Dr. Amen, do you use this type of technology for forensic psychiatric reasons, or just to document whether, it sort of helps you make the diagnosis of PTSD?
Dr. Orton, psychiatrists are the only medical doctors that never look at the organ they treat. And I always thought that was a little nuts. And we use it to diagnose and target our treatment for patients. But it has been used in court a lot to understand perhaps why people do the things they do. And, it's one thing to talk to someone, but we really should be evaluating the organ of behavior, which is your brain. And they literally changed everything I do as a psychiatrist, because what I realized is we should stop calling these things mental illnesses, hate that term, everybody hates that term, and go, oh, these are brain health issues that steal people's minds. Get your brain right, and your mind will follow. So if trauma changes your brain, well, how do we change it back? And there's so many ways. And the first thing is stop hurting it and do things that help it.
Gotcha. And you talked about treatments to help, for example, the anxious brain, but do they also apply to the traumatic brain, PTSD brain?
Well, one of the treatments I love for PTSD is called EMDR, eye movement desensitization and reprocessing. I actually published a study on police officers who were involved in shootings and ended up with emotional trauma, and they all were off work. Well, after an average of 8 sessions, all of them went back to work. And I did the before and after scans, and we saw their very busy brains when we started that had calmed down significantly. So there's incredible hope. We just have to do the right things.
Thank you so much, Dr. Amen. And be sure to check out Dr. Amen's new book, You Happier.